Good evening, everyone. So my next video, which I'm going to discuss with you, is on the topic antimicrobial agents pharmacokinetics. That is uh, area under the curve dependent killing, concentration dependent killing, time dependent killing, and post antibiotic effect. I will discuss these three topics with you in this video. And before I start my video, I want to request you, if you like this video and if it is helpful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you antimicrobial agents pharmacokinetics. Now, this antimicrobial agents pharmacokinetics is basically depending upon the cidal drugs. Means it depends on the cidal drugs. That is bactericidal drugs. They are being divided into having three types of dependent killings. That is concentration dependent killing, time dependent killing, and area under the curve dependent killing. Means these pharmacokinetics are based on the cidal drugs only. And the classification of these cidal drugs are beta-lactam antibiotics, vancomycin, fluoroquinolones, and aminoglycosides. These drugs, they follow the cidal classification, and these follow the concentration dependent killing, time dependent killing, and area under the curve dependent killing. And now I'm going to discuss with you the area under the curve dependent killing. Now, in our body, when we give some drug, the minimum inhibitory concentration reached by the drug is the minimum inhibitory concentration, or minimum bactericidal concentration is the concentration at which the growth of bacteria or the bacteria is killed. Means minimum concentration is like suppose it is 10 microgram per deciliter, and then we increase the dose, like we give 20 microgram deciliter, or the concentration of the drug becomes 30 microgram deciliter, and basically on increasing the concentration, the activity also increases. Means when we increase the concentration of the drug, bactericidal drug, the activity, the killing activity increases. Suppose we give the 100 microgram per deciliter, this maximum highest dose we are giving to the patient, and slowly the drug will be metabolized and the concentration gets reduced. And in the concentration dependent killing, which depends upon the concentration, the killing activity depends upon the concentration of the drug, we give higher doses, maximum highest, safest dose we give in concentration dependent killing, and slowly it reaches the below the minimum inhibitory concentration, and its activity is reduced. And this is the concentration dependent killing, like we give from the 100 microgram deciliter, and slowly the curve, it is slowly slopes down, and it reaches below the minimum inhibitory concentration. And the drugs which follow the minimum inhibitory concentration or concentration dependent killing are the aminoglycosides and fluoroquinolones. In time dependent killing, it doesn't depend upon the concentration of the drug in the body. It depends, like we can give the small minimum doses. Means as we increase the concentration, its activity does not increases. It depends upon the time for which the drug remains above the minimum inhibitory concentration, like 10 microgram per deciliter. We will give multiple small doses in the time dependent killing, and it doesn't depend upon the concentration. Like we can give small doses, like 20 microgram per deciliter is given, multiple small doses are given, and the drugs which follow the time dependent killing are beta-lactam antibiotics and vancomycin. Vancomycin and beta-lactam antibiotics, these follow the time-dependent killing. And area under the curve-dependent killing are the drugs which do not depend upon the time only or on the concentration only. They depend upon the plasma concentration and time graph. Means the area under the curve between the plasma concentration and time is plotted, and the area under the curve it denotes the activity of the bactericidal drug. And the drugs which follow area under the curve dependent killing are daptomycin and fluoroquinolones. And this was all about the concentration dependent killing, time dependent killing, and area under the curve dependent killing. Now, I will discuss with you another type of term which we discuss in the antimicrobial agents chemotherapy, that is post-antibiotic effect. Now, it is the effect in which the drug reaches the minimum inhibitory concentration. It reaches when we increase the concentration, the drug will inhibit or kill the growth. It is applicable to both static and cidal drugs. If we increase the concentration above minimum inhibitory concentration, the drug will be effective. And when we decrease the concentration below the minimum inhibitory concentration, the drug will be ineffective, means it will not inhibit or kill the bacteria. But in some cases, even when the drug reaches after giving the high doses, slowly it metabolizes, concentration decreases, and after reaching below the minimum inhibitory concentration, the bacteria it is the antimicrobial agent is effective even below the minimum inhibitory concentration for a certain period of time. This is why the logic is bacteria needs some time to grow. It needs some time to multiply, like it needs some time to generate, to synthesize this RNA, DNA, and proteins to multiply in the body. The time taken for the bacteria to multiply, to grow, that time is the post-antibiotic effect. It is the even when the drug reaches the minimum inhibitory concentration, it is effective for a particular period of time, and that time is known as post-antibiotic effect. Now, basically, the most common post-antibiotic effect is 90 minutes. It is the common, and below 90 minutes is the short post-antibiotic effect, and above 90 minutes is the long post-antibiotic effect. Now, short post-antibiotic effect is seen with beta-lactam antibiotics except carbapenems and vancomycin. They show short post-antibiotic effect. And the drugs which have long antibiotic post-antibiotic effect are, means we can say all the drugs have long post-antibiotic effect which are active against gram-positive bacteria. Which are the drugs, antimicrobial agents which are active against gram-positive bacteria, they are having the long post-antibiotic effect, even the beta-lactams and vancomycin. And the long post-antibiotic effect is seen with the gram-negative bacteria also, which have effect on the protein synthesis as well as on the DNA, which inhibit the DNA gyrase, which is fluoroquinolones. They also have long post-antibiotic effect, and which inhibit the protein synthesis like tetracyclines, macrolides, clindamycin, aminoglycosides. These also have long post-antibiotic effect. And that's all for the antimicrobial agents pharmacokinetics. I discussed with you area under the curve, dependent killing, time dependent killing, concentration dependent killing, as well as I discussed with you post antibiotic effect. So I hope you understood. If you understood this video, kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed. Thank you. Happy learning.